generous introduction. First of all, I'd love to appreciate the organizing committee of PSG and really thank Dr. Rutul for having a lived experience sharing at this platform. For people living with any kind of diabetes, to get a seat at the table with healthcare professionals is really a privilege. And with that, I acknowledge this privilege, and I hope I'm able to do justice in sharing my lived experience today. I was diagnosed with GDM, and today I live with type 1 diabetes. But since our focus is going to be on GDM, let's look at our overall theme beyond the diagnosis, beyond GDM. And I'm very happy to share my journey and also emphasize that the right education, empowering healthcare professionals, as well as lifestyle and awareness, these are the key things that hold together a person living with diabetes. So here I am sharing my journey. I was diagnosed in 2005. The age during my pregnancy, I was 27 years with no prior family history of diabetes. Even today, both parents, they do not have any kind of diabetes. I was diagnosed with GDM at the 7th month onset, and at the 3rd month as well as the 5th month, screening was done. My blood sugar levels were normal. And at diagnosis, at the 7th month onset, I had a pretty normal fasting, but my postprandial was on the higher side. And then I was prescribed short-acting insulin. My total daily dose was 20 units. And initially, I was on 6-8-8 split. So basically, like my breakfast dose was on the lower one, and the lunch and the dinner was on the higher one. We'll come to that, but what I really understood today, listening to so many enlightening talks since morning, that titration, understanding one's body pattern, seeing what really works for you, that is the key, and that's where the multidisciplinary approach comes in. Exactly, like basically the balanced diet and exercise is the key to hand-holding the person diagnosed with GDM. But this is the clinical side, and the diagnosis also holds something which is beyond the numbers. Like Dr. Nimmi very beautifully put up, that we need to look at the person as a human, as a woman, and not just the patient. So what does a person who is newly diagnosed go through? So we often overlook the emotional journey. A patient walks into the clinic where the doctor gives out the diagnosis and says, here you are put on insulin. But what goes on in that human being's mind is the initial emotional response. There is a state of shock. Why did this happen to me? Obviously, there is a lot of fear because, you have to safeguard your baby's growth and ensure that all of that falls in line. There's a lot of anxiety because you don't know anything about gestational diabetes, a lot of confusion because family is saying something, the doctor saying something. So there are a lot of questions that go on in the mind of the person who gets newly diagnosed. There's a sort of disbelief. Why did this happen to me? What did I do wrong? And then slowly, when you decide this is the only way out, you have to embrace insulin and move on. That's where the acceptance sets in. Now coming to the specific part of my delivery story, I was induced labor at the 38th week because my baby's weight was growing. And my gynec, he decided that, we don't want to take a risk. And finally, I had a normal delivery, vacuum assisted, and the weight of the baby at delivery was 3.73 kg. That's actually my son's picture. Now, what we need to empower people who get diagnosed with GDM. I think this is where, the role of the diabetes care team at the HCP's office, at the clinic, we need to tell them about the difference between the myths and the facts. So I'm just going to quickly go over this because I think most of you know this, but GDM is not caused by eating too much sugar or poor dietary choices. In fact, it is pregnancy-related placenta hormones which are affecting the insulin function. It's not only the diet. Only overweight or unhealthy women get GDM. That's a complete myth. It can affect women of any body type or health background. Gestational diabetes is permanent. So for most women, BG levels do return to normal, but of course they are at a higher risk. Now coming to the social stigma and its effects, and that is where the lived experience role comes in, which is more important. GDM is hormonal. It's a medical condition, not a personal failure. Think of a woman who's living in a joint family and is supposedly very excited about her first pregnancy. The minute she's given the diagnosis, what goes on in her mind? She's constantly feeling judged by the medical care team, judged by the spouse, judged by the extended family, the parents. There's a lot of burden that she carries. Many times we are labeled as bad mothers or responsible for poor dietary choices. And then what happens is they are forced to hide their diabetes because of lack of choice, because they don't want to deal with more criticism from extended family. Many a times these women experience isolation, shame, and a lot of hesitancy to disclose their diagnosis. Now, how does this impact the well-being directly? Because of this, they feel guilty. Many a times they go into a low sort of depression with self-blame, anxiety, and they don't want to comply with the recommended care. Many a times they want to hide, they want to eat things which they don't want to report back to the doctor. So we need to encourage open discussions. If the HCP team can actually give that kind of empowerment and have it like a formal family discussion, there will be much more support from the family. So encouraging compassionate dialogues really helps in these cases. Now, what worked for me? We have discussed this quite often, and even Ms. Cheryl has spoken about nutrition, but what really worked for me was meal adaptation with small meals, regular intervals, so that there was no glycemic load on the body. Balanced meals with fiber, protein, and complex, moderate carbs. The role of carbs is very important here because we are trying not to indulge in high fat or dairy fat. We are trying not to indulge in fast foods or processed foods with high sugar, because typically we are told by families and friends that if you are pregnant, you will get cravings and you must fulfill those cravings, which is actually not advised, and it is important to address this with compassion so that you understand what really will help you in the long term. No skipping meals. Fasting is avoidable. Load of carb needs to be managed, but avoiding carbs is not advised. The most important thing that I share with other peers in the community is not to fear carbs, but make informed decisions about taking complex as well as moderate carbs. Now, there will be cultural, social pressures related to foods. So we need to make sure that we manage those and have an overall healthy weight gain. Physical activity with active mobility, walking, yoga, light breathing exercises, and meditation really helped me to manage my mind state. Back then, we didn't have so much of sensor usage. So most of the time, I managed with glucometers, where the frequency of checks initially was 3 to 4 times a day. But later, I realized it's really good for me to monitor more. So I increased it, and then it really helped to have the mental health in the right place. Like all the time we are walking a tightrope walk, how much food is enough, how little is too little. So to find that right balance is important so that the mother is healthy as well as the baby grows in a healthy manner. What really helped? Yes, mindfulness, having a routine, and seeking professional help as and when required. The social and family support is very, very important. Having a partner who can walk this journey with you, sharing this very openly in the family so that they do not misjudge, and then have a good community understanding. So my mantra is BBB, bolus, balance, and breathe. So these actually address the most important choices we make. Bolus, do not fear insulin. I would be lying if I say that I was very positive from day one. I wasn't. Of course, when the doctor gave me the insulin in my hand, I was very fearful. But it was worth going through that journey to understand that this is the only way out with GDM. So the right insulin choice, injecting as per the action time, having informed awareness was important. Optimizing nutrition with the right food order, including fiber as well as protein, balancing the macro and micro. And then leading not only an active life, but remember that movement can be medicine. Like I heard one of the speakers say that after every meal we advise that the person should walk for 10 minutes. I think that is the most undermined, freely available resource that doesn't bind you with what you can afford. You don't necessarily have to go to a class or a guided program. You can walk and manage your levels. Understanding monitoring, because monitoring is the most undermined but very important part which can help you improve time and range. And last, most ignored but most important is self-care, self-love, and stress management. Very often the mother puts the needs of the baby first, but not realizing that your cup needs to be full to pour more into this. Now, going to the life after gestational diabetes. What helped me in my postpartum journey? Of course, physical recovery is required, but the emotional transition to dedicating your time to a newly born baby. So when you are looking after yourself during the pregnancy, the focus is fully on you. But after the delivery, to realize that you need to share that time with a newly born, and the newborn really needs a lot of your attention and care, and yet not to ignore your needs. So carving out that 1 hour or 45 minutes, depending on the need, to find time for your walks, to refill your mind state with meditation or mindful practices. And one more important thing is, a lot of times there is lack of awareness on how important is breastfeeding. I totally practiced that. That point, it wasn't really emphasized by the doctors, but when we listen to our mothers or mother-in-law, they really emphasize this part. And I think that really helped me. So for almost 8 to 9 months, lactation can really help you to marginally reduce your blood glucose levels. After my delivery, my sugar levels had come down to normal, and it was pretty smooth when it came to managing. But complying with regular checks, that's a very important and undermined part of postpartum care. GDM changed my health outlook forever. I think what is very important is habit-forming, outlook. When you have already formed a habit during your pregnancy, after your delivery, it should not be too much of an effort to go for a 30-minute walk or actually practice a 20-minute yoga session. So this is a very important part of habit forming which needs to be inculcated during the pregnancy itself. We'll very briefly talk about awareness, what every woman should know, the risk factors before and during pregnancy, the awareness around the symptoms, and the importance of postpartum glucose testing. I think, here my healthcare professional really empowered me by saying, every 3 months you need to be checking your blood glucose levels. So those are the very important parts of managing someone with GDM. Now my final thoughts, empowerment comes from knowledge and choice. I've been blessed with really caring healthcare professionals who really looked after me, but we need to ensure that the same care is given to newly diagnosed women. It also requires a multidisciplinary approach, right from the gynec to the endocrinologist to the diabetes educator, sometimes even a support group, a person who has gone through the same journey. I think that's why I'm here today, to share, to learn, and with a pledge to go back home and alleviate this fear of young girls who want to start a family, but they don't have the courage. So I hope that my journey can really inspire many more girls to start their journey. Discuss the options with your diabetes care team, be aware of what your challenges are, address those challenges, and look forward to an informed choice pregnancy. And remember, the best system is the one that finally works for you, because pregnancy is not one size fits all. Everyone will have unique experiences. You need to understand your body's response, your body's pattern on each of the aspects of pregnancy, and go with that. And finally, this is a picture of my son. and now he's 20, and I do recognize that I have risk, and I'm now a type 1, but I do recognize healthy lifestyle is important for everyone, even for him. So habit forming, culturally sensitive, as well as joint family discussions are very, very important for all of us. And thank you so much for this opportunity, and I hope we can inspire many more young women to live a stress-free and complication-free life with pregnancy. Thank you so much.